Good morning, everybody. Robin Strongin here with Health Dame, and today I am really excited and so pleased, Karen, to welcome you to Health Dame, Dr. Karen Remley, who it may take me all 30 minutes to talk about all the really cool, unbelievable things that you've done throughout your career, which centers on the littlest of people, pediatrics. So really near and dear to my heart. And I'm going to let you help. I'm going to say a few highlights and then want to hear from you. We have a lot to talk about. I do want to do a shout out to Dr. Joanne Conroy for bringing us together through Women of Impact, and Christine Malcolm and Leah Binder and so many other women that I'm having the chance to also talk with on Health Day. But today it's all about pediatrics and public health and some of the true. It's really nice when we have advances that we could point to where things are getting better, but I know you will be stressing how important it is we have to stay vigilant because all of the work and all of the progress can disappear if we're not really focused on making certain that these little guys are staying as healthy as humanly possible. So Karen, just a couple of highlights, and then I'm going to turn it over to you. I know you were trained as a pediatric emergency room physician, which just blows my mind. How did you come to that particular area of specialization?
Yeah, I did. I went to St. Louis Children's for my residency, which was very tertiary care pediatrics,
Okay.
and then spent 2 years in private practice and really enjoyed it and had fun and really got to know families and how they were engaged outside of a hospital setting, which was really important. I always laugh because when my first baby was born, I had 34 baby blankets because every mom either crocheted or knit or,
Oh my God.
everybody wanted to get, but I also had this amazing group of women who I could say to me, "Give me pearls of wisdom on
Ah,
what you wanna do." When I did my residency at WashU, it was very much, tertiary care and taking and learning how to care for children with complex problems in hospital settings. So, I then did 2 years of general pediatrics, and that's kind of the theme of my life to say, "This
mhm.
is something I've missed, I need to learn more about it. How do I do it?" I went to the best pediatricians in St. Louis and said, "Can I work with you?"
Wow.
Had a wonderful experience there, and learned a lot, not just from the pediatricians, but from the mothers and
Oh,
fathers of the children I cared for. And I laugh because I love to say I got 34 baby blankets when my first daughter was born because all of these moms, they traveled through my pregnancy with me and they helped tell me how to breastfeed and they helped tell me what do you really need and what don't you really need. And so it was just a wonderful experience, but I missed the ER. I always
yeah.
worked in the ER and I liked the pace.
Exactly.
I
Yeah.
realized what I really liked about the ER is you really have to say before you walk in the door, here is a mom or a dad with a child at one of the worst days of their life, because nobody ever wants to take their child to an emergency department. And how do I establish rapport, a trusted relationship so we can walk through this horrific car accident injury or this baby with a very high fever or this child that's having a seizure? Those are the things you're working on. And how do you do that in a way that they, on that worst day of their life, feel like they have a partner? It's very much a team effort. And that's what I really enjoy.
So that probably was a great background for, I know you have an MBA as well, and you did work with some insurance companies and payers, but you also did public service because you were the health commissioner, let alone the CEO of the American Academy of Pediatrics. So, and then two different governors, I believe you did, right?
Yeah, I've worked in every part of health and healthcare you can, I think. I've you're like you said, I got my MBA because I would wanted to understand the business of medicine
Sure.
because people would be mad at the business people at the table. And I would think, maybe I just don't understand what they're doing or why they do what they do. So that was why I
Sure.
got my MBA. I got my MPH
Yep.
because I wanted to really understand more about epidemiology and how the classically trained public health people think.
Mm.
And you're right. I've worked for health plans, was a chief medical officer in a hospital system, and worked for Operation Smile and Physicians for Peace. And then, really enjoyed being able to be the state health official for Governor Kane and Governor McDonald, two different parties.
Yep.
Was the first commissioner in over 100 years that stayed when the party switched, which was before things became very political.
Yep.
And as you said, went to the American Academy of Pediatrics to be the CEO, and then lastly to the CDC,
Yeah. Yeah.
be the center director for birth defects and developmental disabilities. And I think the overarching theme of my career has been it's okay to say you don't know enough about any subject and go learn about it because
Sure.
we can all learn whenever it is. And, it's great
Always.
to learn about it. And I think my North Star has always been children and families and how to help children and families in whatever role I'm in, navigate their our future.
They are our future. And what's exciting, and we've talked a little bit about this, when we would get together, about how fortunate that the work that you and your colleagues are doing in the field has seen some true advances, where in the past, in the ER, you were seeing horrible deaths, preventable illness and injury. Nowadays, there's been true uh, advances where the numbers have plummeted, which is what we want to see. The onus is on all of us to make sure they stay. And then I know you've been doing some research and thinking about some of these unintentional and unintended illnesses and injury that's now we're seeing such progress. Can you say a little bit about what you've been seeing?
Yeah, and I think part of this, the reason I started really thinking about this was as we watched over the last year, the impact that vaccinations have had on children's
Right.
lives is huge. The impact of fluoride has
Yeah.
had on people's lives that we no longer have mouths full of fillings, and we don't have people who get dental abscesses, and both of those things are at risk. And I thought, what are the other amazing things that have happened in the field of pediatrics to save children that are at risk? And went and looked at the data, and there's been a 61 decrease in the number of unintentional injuries in our country since 1980. And I looked at 1980 because that's when I started my pediatric residency.
Yeah.
That in my career, think about 61%, how many more children are living into adulthood? And then I started thinking about what is it? Well, it's car seats,
Yep.
which, uh, it is fences around pools. It's babies sleeping on their back. It's not having bumper pads in beds. It is so many things we do. It is bike helmets. And all of those things require a level of research at the clinical level and the bench level. It requires people in public health identifying where the disparities are. And is there a way to improve it and measuring that improvement, right? And that's what those numbers show is yes, we buy car seats and they work. And with car seats, we also have slowed down how fast we drive. And
Right.
we put, better road conditions. And it's all this complex ecosystem, but it also takes pediatricians talking to parents about why it's important. And it takes policymakers to talk about why it's important and to have either regulations or laws. So it's interesting. There's no federal law that says a child needs to be in a car seat. It's state by state by state. And so that's where I worry as we have more and more of these conversations about individual choice that you're asking a brand new mother who has a baby who's crying, who they're taking them home from the hospital and saying, it's up to you whether you put them in the car seat in the back or not.
Right.
We've got to do a better job of educating people about this and having them really understand why it's okay to have their baby be in the back seat and you can sit next to them on that trip home from the hospital
And
rather than holding them in your lap in the front.
absolutely. And I remember when I was first, also in the 80s, getting my degree, I remember reading about, and I always tell the story because my background's more on the communication side, and it's who are the trusted individuals to help educate. Of course, it's the health provider, but to your point, when you're being discharged from the hospital with a newborn, particularly for first-time parents, everything is overwhelming and terrifying, and your instinct is to hold tight to the child. Like you're the safest, most protective of anything or anyone. And I remember it was a there was a study that came out, and it was years ago, and it was down in Texas, very close to the border, and it was a large Hispanic population of moms. And the uptake for these car seats were close to zero. And the hospital was trying everything. It had abuelas coming in the dialect to try to talk to the families during, prenatal. They had data, they had people from the CDC coming down. They had physicians and CDC people coming to talk to the community. Nothing doing. Finally, someone had the idea to have the local parish priest
Mm,
come, have them bring the car seats, holy water and blessings on the car seats, and the
yep.
percentage went straight up. And then the pediatricians were able at the visits to reinforce the emotional, but it gets to today's challenge with some of the mis and disinformation. So this is a really big problem that we're facing. And I assume, especially what you're talking about, where there isn't a federal law, how can we help the pediatricians do their job so we can help educate and push back against some of this stuff that's flying around out there?
Well, and I'm starting to feel a little bit better about it because I think
Okay.
pediatrics felt very much under siege, in the last year and a half with all of the efforts to disband the immunization funding, looking at the immunization schedule and making changes. Those are the kinds of things that were gold standard science has been carefully thought through for many, many, many years. And
Sure.
again, I mean, I remember the pictures of when I was a little girl of all five of us sitting in a row, all with mumps. Half
Oh,
of us were this big, half of us were this big. I remember all of us having measles. All of us had chickenpox.
yep,
And I think
same.
about, all of those diseases and the really significant morbidity they can have. And we have a generation of pediatricians who believe and understand the science of vaccines, but haven't always seen those diseases to be able to speak to them.
Yep.
Sadly, now they're going to. Sadly, now these are people who never saw measles who are now seeing measles. But I also want to make sure that we think about pediatrics as so much more than infectious diseases. Children are still more likely to die in a car or
Mhm.
die, in a playground or drown in a pool than they are of a significant infectious disease. So we've got to support our pediatricians and people who care for children, whether it's at Head Start or at, daycare or at preschool, that these are important conversations to have. I heard my grandson say to somebody yesterday, because he had his helmet on when he was on his scooter in the park,
Yeah, yeah.
the little boy had taken his off and hadn't put it back on. And Theo said, my grandma says that if you fall, you hurt your head and you'll never be smart again if you don't wear your helmet. And I thought, interesting way he translated what I said, which he was giving a public health message, which
He
was
sure
saying that
was.
you want to make sure you wear your helmet because you want to make sure you keep your brain.
Right.
And so
Exactly.
the thing that I find fascinating there is it's really about meeting people where they are. What do you like to do? What do you do to make sure you're in a safe environment? How do we make that work with your child? How do we think about that? And it's hard when you're a pediatrician when you've got 20 things to cover in a
Yep.
20-minute well person visit.
I
And
can
right
only
now,
imagine.
vaccines can eat up all that time. So we have to figure out ways to empower our pediatricians to have those conversations, but to also think about how do I collaborate, like you said, with the priest. So if I'm having a hard time getting that message across, I don't have to do it all myself. Where else can I
Exactly.
go? Who else can help me? Is it the schools? Is it the churches? Is it daycare? Where else can we have those conversations? And I think that's really important.
It is. And do you find that your colleagues in the field, the trusted relationship with the growth of telehealth and the growth of AI and the growth of technology. Because I know in some instances, physicians I speak with, particularly those for whom they're dealing with very sensitive issues, it could be sexuality or something along those lines. AI can be helpful to some extent. I don't know if it's made the inroads in pediatrics the way it has in some of these other areas of specialization. What are you seeing in that realm?
The only places I've really read about it being used is with children with complex healthcare needs.
Ah, interesting.
To be able to predict and think about, okay, in the next, here's where they are now. Where do we think they'll be in 2 years? Because a lot of the hard thing with children with complex healthcare needs is there are many in our country, but very few in people's practices. So, when you're in private practice, when I was in private practice now 40 years ago, I had my first child who had trisomy 21,
Right.
or Down syndrome, and because I was learning about it with a mom and we were doing everything together. She told all of her friends, and the next thing I know, I had 10 in my
Right,
practice. But I think part of that is empowering that AI at that complex need. I think what the question you're asking, and I could be very Pollyanna about this, but there is, as you said in the very beginning, there is nothing more important that any of us do in life than help try and raise next generations.
right.
And pediatricians are always looking at the whole child and the whole ecosystem. And so I think the relationships with parents has been, I want what's best for you and for your child. I want to help you get that. I'm not in charge of it. You're in charge of it, but we're partners as we work through this. And I think the huge debate about vaccines has
Mhm.
eroded some of those relationships, but I can tell you I had a colleague from the CDC who was in Texas last spring having
Okay.
conversations with people who were not getting their children vaccinated for measles, and she said they were some of the most lovely, caring people I've ever met, and I realized I had to she had to remove her misconceptions of what they were worried and thinking about and approach the problem from a different perspective. And I think that's the important thing about pediatrics is you're always trying to figure out here's this child who really we just all want to do what's best for them, and by walking away or by being angry you're not going to make that happen.
Exactly. And that's where some of what we were taught with communications really matters because it's
Yep.
often about who is communicating, what information you're communicating, how you do it can work magic and to be able to listen.
Yep.
Where is the fear coming from? So there's no one answer, which is why I think we are where we are with some of these complex issues we're facing. And the vaccine stuff does eat up a lot of, I'm sure, the time of pediatricians. But I do know you had mentioned, and we talked briefly about it. I want to bring it up again. So, for children who have these very complex medical needs, and there are a lot and growing, some of them are invisible because their conditions aren't readily viewed as someone may be a child in a wheelchair or something. So you do often, because I know I serve on the board, I was mentioning the physician parent caregivers that Dr. Santi Bhagat founded because her daughter, who's now an adult, and she's very public about this, both she and her daughter, has just very serious epilepsy. And so the challenges of raising a child who then ages out of pediatrics and because of technology and innovation finds their way into adult medicine. I wonder what you're seeing in terms of these chronic complex conditions and aging out of pediatrics. Where do you see that trajectory going? There's
It's
probably a
it's
million directions.
it's getting better.
Okay.
So what I would tell you is back when I was in training, we all of the young adults with cystic fibrosis stayed at the children's hospital, because they were dying in their 20s.
Right.
And so, the pediatric specialist and everyone would say, "We're just keeping them because we know how to take care of them.
Yeah.
Mom and dad are comfortable with us." Well, now people with cystic fibrosis are not only living into their 50s and 60s, they're having children.
Yeah.
And so they need to have that transition happen. I think it's happening faster in some fields than others. So,
It
for example,
is.
in cardiology, there are so many children now that had complex congenital heart problems that would have died in the 60s and 70s and 80s have now had life-saving surgery. One of my first patients in private practice is just turned 50 and has 2 children and was told the first surgery he had, it's very unlikely he'll survive.
Oh,
So we've gone from that, in 1983 to, now here he is. So I tell you, it's a huge difference and so all of those people, and then he'd be an example, has some complications that are secondary from having his surgery a long time ago.
sure.
So electrical rhythm changes, things like that. There are special clinics being developed around the country so that that cardiologist might not see only 2 or 3 people in his career that have had complex surgeries for heart disease when they were
Mhm.
baby. but they
Mhm.
understand what to do. They can use AI to help them figure out what are the things I should be thinking about. Sometimes it's hard to even go back and find records. I
Mm.
think more and more with diseases like sickle cell disease, cystic fibrosis, there are adult kind of specialty clinics that care for them, but those are very disease specific. What you were
Right.
also talking about is the children with complex medical needs that are multifactorial. I have cerebral palsy and I have a seizure disorder and I have mobility issues. Now, I've got to go to multiple different doctors and maybe I also have problems with urinary tract infections.
Right.
And I used to be able to go to my pediatric home and they would help organize all of that care.
Now,
Now I have no home.
right.
And it's very hard to navigate that. And I think that has been something we've been talking about in pediatrics for at least 25 years. Adult medicine kind of thought, well, the solution was you just send them to the ER,
Yeah.
which is not only horrific for the patient, it is also very costly and normally doesn't solve the underlying problem.
I know it
So I
doesn't.
do think there is more movement now, especially as many adults with disabilities are federally insured.
Yeah.
They're government insured Medicaid. There's more interest in how do we do better coordination? How do we coordinate that care? What is missing, and I'm sure you're very well aware from your experiences, how do we really listen to that patient and hear what they want and empower them to be to lead the care team, not just be part of it, but to be the leader of the care team.
Exactly. Exactly. I'll have to connect you to Santi, to Dr. Bagat, because I think you guys would have a lot of common areas where you could learn from one another and really, as you said, take this to the next level. Because I think in some conditions, there has been tremendous progress. And then from a systemic system situation for these young adults, they're really left almost alone, and it's a lot to manage if you're healthy. It's almost impossible if you have all of these conditions that make life challenging, but have the potential for a long life. It's just how do we get a better quality of life for these young people who have some additional challenges facing them as they
Mhm.
go through. I'm really what were some of the really interesting things being a commissioner of health that you found yourself right in the middle of? What
Yeah,
were
well,
uh,
every day every day you never knew what was gonna happen. I
I
mean, you
bet.
just never knew, and it was always different and always exciting. I never thought when I went to medical school that I would become an expert on septic systems, but, that they were under my purview, and so I took this is how, I think my head of environmental health laughed at me because I said, "How do I learn about it?" And he said, "Well, we have these 3 courses." And I said, "Well, send them to me and I'll do them at night so I can learn if I'm gonna
Yeah,
approve something, what I'm
yeah.
approving." In our state, they had a certificate of public needs. You have to approve hospitals and hospital beds, but also things like you may remember there was an earthquake.
Yes, I do.
And
My son was at UVA when it happened. I
so there
very
was
much remember
there.
it.
Yes, and it was also Washington City, and I said to my team, we all left the building, and then it was time to file back in when they said it was safe, and I said, "So what would we do if it was a bad earthquake? Let's go to the Emergency Operations Center, and this is a great opportunity to plan."
Sure.
Well, we
Yep.
went, and, we learned very quickly that the epicenter of the earthquake was at Lake Anna, where there's a nuclear power plant,
Yeah.
and I said, "Well, how would we guarantee," and this is before Fukushima. I said, "How would we guarantee that nothing bad happened at the power plant?" And the first thing somebody said to me is, "Well, they'd call us if it did." And I'd said, "Okay, but we want to trust them, but we want to verify. What
Exactly.
else would we do?" And we ended up saying, "We're going to test the water, the
Yep.
effluent that comes from the reactor every day for 6 days." And I called the secretary and his question was, "How much will that cost?" And we said it was nominal. And I said, "We're gonna do this." And the funny thing was the next day, they reported that there were cracks in the casks that held the spent nuclear rods.
Yeah.
The governor was able to say, "We're already testing for it. We are on top of it.
Right.
We're on it, we're doing it." So I think what I always loved about being commissioner is people think I'm crazy when I say it. You're always in preparedness and response mode because you
Have to be.
never know what's going to happen. And then you have to stop and think, okay, how would this impact the public? What are the things I am responsible for? What do I need to find other partners in my state to help me with this? And how do I support the local health director if it's a very local issue? And so I always really enjoyed that. And I always say the most important thing, you talk about communication, crisis communication to me is just common sense. It's that, you need to always be first. Don't wait with information if you
Right.
have it. You have to be right. You have to say what I know and what I don't know. Don't make anything up, and don't hide things.
Right.
You want to be credible. You want people to believe in what you say. And then I say you always want to give people something to do.
Right.
What is it you can do in this situation? And then I would always tell people, and this is when I will know more. And whether I was sending an email up to the chief of staff or I was talking to the public about H1N1, I always use those 5 principles, and if I did that on my hand, even if it was like a emergency that you didn't even know you were gonna be talking, you could always make sure you kinda covered the key important things that needed to happen, and you became kind of that trusted voice to the governor
Sure.
or the trusted voice to the public.
So I definitely can I know that's what you love doing because you were an ER doc. So all
Yeah.
of that unpredictability and what can I jump in and fix and do quick and do well and get everybody calm again. So it's definitely that same environment that's a pressure cooker really. But wow, how extraordinary. I guess I would ask what advice or what questions would you have for new people coming into the field of pediatrics? What do you think they should be thinking about if they're looking to dedicate themselves to this particular specialization?
I think really, making sure you know what your North Star is
Mhm.
and figuring out a way to bolster yourself up and do that. I remember when I started in pediatrics, you weren't supposed to talk to patients from the ER. Once they left, they weren't your patient anymore.
No.
And I frequently, especially for those young moms that, especially we worked in Eastern Virginia, dad was out to sea on an aircraft carrier. She was living 500 miles from her mom. The baby had a
Terrified. Yeah.
yeah, baby had a fever and she's in the ER at 2 o'clock in the morning. I would sometimes just pick up the phone and call him back the next day and
Um,
say, just calling to make sure temperature's still down, everything's doing well. And I knew I was stopping them having to come back to the ER again. But more importantly, they were just getting a little bit of caring.
yeah.
And so I think taking the time to stop and think about that, I think is so important. I think it is so hard right now if you have the kind of people who come in with a million sheets of, I read this and I read this and I read the influencer said that and that and that and that and that.
Yeah.
It's so hard to get your arms around it. And I think it's trying to find and it's funny that it's you're asking me this question because there's so much knowledge, but they're all really smart people and they're going to be great doctors with the knowledge part. It's figuring out your own personal style
Yeah.
of communication and how does that work with the people you're talking to. How do you get them to feel comfortable with you? I think is so critical.
And I think it's doubly, well, even triply tricky because often it's a mom and a dad or two parental units and a little person. So you're really caring for a unit of
Yeah.
people. And it's everyone might have a different idea of what good health or good practice appears. And you're right smack in the middle of it. So communication and who's on first is it's probably a bit of being an octopus from time to time.
Well,
But
and yeah, understanding the dynamics.
yeah,
And sometimes it takes a while. And sometimes you just have to be really honest and say, excuse me, before we get started, could you explain to me what your relationship is,
sure.
with little Joey? And so you can kind of try and figure out who's taking care of him, who's with him. Standard question I always ask, and I still ask is public health or I get phone calls all the time
I
from
bet.
young physician women who ask questions. And I always say, what did your mom say?
Yeah,
Who else told you something about this? So you kind of know where am I
where it's
starting
coming
from?
from. Yeah.
Yeah.
Yeah, which is and today it could be anywhere because we did a program when I was back at National Consumers League on young people listening to TikTok influencers about how sunscreen causes cancer and it's better to be outside in the sun all day because that's how you should get your vitamin D. That's what young people are doing and not so young people. And obviously there's reams of evidence, reams of data. And that doesn't mean that in the past there might have been ingredients in something that could be better and safer, but that's why there's ongoing testing and ongoing studies. It's back to your
Mhm.
epidemiology, look at the data, look at the evidence, share the information, and, go to trusted sources. And we're back to having to re-educate in a way that everyone feels comfortable.
Yeah, but I think the hard thing there is if they think of that influencer as a trusted source,
Yes,
your job is to become a trusted source, not to say that trusted source is wrong.
correct.
But to try and figure out how to get, had a lot of conversations with people about vaccines. And normally it's, why do you feel this way? Where did you learn about this? What have you read?
Mm.
Let me tell you what this infection looks like and what not vaccinating would mean if your child got sick. And then these are important decisions you need to make, and I think it keeps them in a place of power, but you're trying to help explain to them what is out there and what, like you said, what the science is and why, vitamin D is really important, but people don't die from a lack of vitamin D unless they live inside and nowhere else. And none of us do that, right? But malignant melanoma
That's
is a
not
horrific,
anything you want in
is
your
a horrific cancer.
vocabulary.
Yeah, and is becoming more common. So that if you're gonna pick, but I think that's hard, a lot of influencers don't say to people, "You're making choices, all of life is a choice." But we have to figure out what the choices are and how do we think about the information for us to make those choices.
Exactly, and I would say particularly where it affects more global public health, so the vaccinations, if you don't vaccinate your child, that's your personal decision, but if you send that child to daycare or school or a crowded bus, then it becomes public health
Right.
situation because other people are going to be impacted. We have not discussed, because I think it deserves its own special conversation, but gun violence in this country,
Mhm.
I'm sure, particularly as an ER physician, with kids, I don't have to tell you, we've
I
had these conversations. So,
Yeah. No, I had to say to a really good friend of mine who happened to be an ER physician who had guns in his home, "My children can't come play with
right.
your children." Until you have them all locked up and have this locked up in one place. And, we had a very good conversation. He said, nobody's ever really talked to me about it before. And he did, because he said, well, I knew they weren't going to bother me. I said, listen, they're the ones that told me you have them. So they know they're
So
there.
they know. Yeah. So,
It's the same conversation you have
yeah,
about why you don't want to let a kid stay in a car by themselves and drive off. I mean, they're all just, and I think we tend to make some of these conversations harder than they need to be because it's just all about, I always like to say, every child deserves a cocoon of love. And part of that cocoon might be a car seat and it might be vaccinations and it might be, having people who understand how to deal with a difficult toddler. I mean, there are a million things you do to help that child be surrounded by love and grow and flourish.
absolutely. And I guess I have two final questions and then I'll let you go
Mhm.
back to your busy day. But one is, I was just talking with Dr. Shika Jain and Christine Malcolm
Uh-huh.
about women in medicine and the summit and the burnout. And I would assume pediatrics has a pretty high burnout rate. I mean, that's a tough field for
Um,
many reasons, or tell me about that.
it
Or not as
does.
much.
It does, but I think, again, I'm always more Pollyanna, that cup is half full. It is very hard because the majority of pediatrics by far and away are women.
Mhm.
So they are trying to be the best mom they can be, the best pediatrician they can be, the best friend they can be. And it's I mean, you're always on.
You're
You're
always on.
always on. And so, and they're in one of the worst paid specialties. So,
Fair. That's
you
fair.
know, and, and I'm sure that they talked about this, but huge burden debt. coming out of medical school. And we have that burden, that debt burden. Then you've got to, you're not getting paid a lot, and you're leaving, so you've got to have good daycare for your children, which is expensive. It
Very
becomes
expensive.
it becomes very difficult very quickly. So again, I think when I talk to pediatricians, it's still the joy of learning, the joy of solving complex problems, difficult cases, and doing it with a family
Yep.
that really truly appreciates it. That's what helps prevent burnout, and it's trying to figure out how do you bring joy? What brings you joy?
Well, and I think that the question of joy brings us back to where we started, which is the number of avoidable and preventable injury, death, and so on. It's there. We just have to be good stewards of ensuring that it doesn't get rolled back for whatever reason, political or otherwise, that public health, evidence, data, talking to everybody, young people, elderly. Wisdom is intergenerational, and it's on us to make sure that these advances, which what pediatrician, what doctor wouldn't want to be, seeing all this avoidance of these horrible situations. And we have that power, and pediatrics has done an incredibly exciting job, a really good job. I mean, I was always terrified as a parent because I'm always worse. Life best case, except when, it's someone I know, then I'm always like a nervous wreck, a headache's never just a headache and blah, blah, blah. I was not the kind of mom you would have wanted to see. I was always a
Oh, no,
little
no, that
on the
would be
hysterical side, but somehow my kids made it through. And anyway, it's just very encouraging. Uh, there are still a lot of areas where we have work to do, particularly with these complex conditions, with the young adults who are aging out of pediatrics and lost in a system that
Mhm.
isn't really working the way it could for them. Hopefully, we can make some inroads there. But what a wonderful time to be in this field. But what an opportunity to make sure we keep it as good as it can be and keep going further. So like you are, Karen, I'm very optimistic. I think there are incredible people doing incredible work, and they're really like you, dedicated to seeing this. I mean, you spent your entire profession making sure these little kids are going to have the best and healthiest future they possibly could. And that does mean figuring out who we have to work with, both inside medicine and outside.
I think the one thing I didn't mention, is the huge increase in mental health
Oh,
and
yes.
behavioral health issues for children, which, again, pediatricians aren't trained to deal with all of that. There aren't enough providers. It's very difficult.
Yeah.
And so I think that is something that very much worries me. And
Mhm.
we as a society have to think about why it's happening and what we can do.
Yep.
Because it's, all of public health and pediatrics is prevention, early intervention, and then, more complex therapies. And right now
Sure.
we're waiting until they make it to the ER door or to the pediatricians to start to think about prevention and early intervention. And so that is an area where I think there needs to be, and right now there's not a lot of funding because a lot of the federal government funding is going away, but really trying to understand root causes, differences, disparities. How do we tackle this? What is going to really work?
Well, I can't wait to see what's next for you because you never stop. So I always learn so much from you. And I'm going to end with my final question that I ask everybody, which is what song you can share that best reflects your work, how you think about what you're working on, what you've been working on, so we can add it to the Health Dame playlist. I have my pen. I'm ready to
Yeah.
write.
Yeah. And I'm gonna cheat and give you 3, and there's a
Three.
reason
Oh, fabulous.
there's a
Okay.
reason why,
Okay.
because they all make me cry and smile at the same time. "Isn't She Lovely" by Stevie Wonder,
Mhm.
which is about when his daughter was born, and you can hear her crying in the background and cooing in the
Oh,
background when you listen to it, and it's just, you think about Stevie Wonder who, went to a state school for the blind, and here he is, known all over the world and is having a baby, and you can just hear the
the
joy in his
joy.
voice.
Yeah.
There's a Nappy Roots song, it's called "Good Day," and in it, they have a bunch of children sing, and it's all about all they really wanna do is have a good day and go to the park and play. They don't want anybody to get shot, anybody to get
Oh.
hurt. They just wanna have a good day, and it's such a It's such a real this is what kids want. Kids
Yeah,
just go have fun,
they
you
just
know?
wanna play. Yeah.
And so it's just a happy song, and then the last one is "Happy" by Pharrell, and I
Oh,
would tell you, if what I do is I always Google it because there is a camp for children with who are deaf, who sign the song and dance to it, and they are just, again, so happy, so full of love and joy, so enjoying showing off their dance moves. It is just the most fun thing to watch, and those are the things that I would do when I needed just a little you just wanna remember, "Why are we doing this? We're doing it
yeah.
that." That's what we're doing it
I
for.
love all of those. I will add all of those to the playlist. They're amazing. And the One Good Day, that's Abby Root, you said is her name?
Nappy Roots,
Okay.
Nappy, Nappy, Nappy Roots. It's Good Day.
Okay, I have to look that one up. I don't know that one. I know all the
Very
others, but oh my God, how wonderful. Well, Karen, thank you for taking the time to talk with me. I really appreciate it. And we will be back in touch because I have a million more questions as always. But you enjoy the rest of your day and I will circle back. Thank you so much. Dr. Karen.
Enjoy
Remley.
enjoy yours too.
Well, bye now.